Can we make stem cell therapy for knee osteoarthritis better? Stay tuned. Hi, I'm Dr. Edward Laniewski, board certified orthopedic surgeon with cellularhealing.net and also with Rehabilitation Physicians PC. And we're going to talk today about making a stem cell procedure better by the outcome by taking a few steps prior to the procedure. So just like you would prep for a marathon, just like you would prep for a test that you had to take, we can prep you before you have a bone marrow derived stem cell treatment for osteoarthritis. Most of this is going to be in the knee, and this is where we've had the most success is in the knee, but other joints can be used too. So we can look at things that we can easily give to a patient that they take about 36 to 48 hours prior to the harvest of their bone marrow. And that can increase, number one, the number of stem cells per square centimeter of bone marrow that we aspirate. And number two, it also can prevent those stem cells from getting caught up in your spleen, in the germinal center of your spleen. So I'll kind of explain. So first of all, there are certain things that you can do to increase the number of stem cells per square centimeter of bone marrow. There are certain drugs that people do take that can be quite expensive and quite dangerous at times too. But we found another way to do this that's very easy, very economical, and very safe. And you just take that about 36 to 48 hours before, and that will increase the numbers. Also, a little known fact, but should be a well-known fact, is that wherever I give stem cells, if I rub it on your skin, I inject it into your joint, I put it into your spine, a majority of those cells will end up in your bloodstream very quickly, usually within about an hour, and they will go to a place they like the best, and that is the germinal center of your spleen. It can also be within your lymph system, but most of it is within your spleen. And we have lots of evidence to support this. And in fact, a lot of researchers that do research on animals with stem cells will know that if you give too many stem cells, you have to watch out for the spleen because it will rupture. So even if you put it in a joint, which you think is an enclosed space, these little cells are just like pollywogs in a pond, and they will go directly to what they like the best, and that's blood vessels. They come from blood vessels, they will go back to blood vessels, and as soon as they get on a blood vessel, they're within the blood vessel, and they will be transported to that germinal center of your spleen. But again, if you pre-treat, you blunt that response. So those stem cells circulate in your blood rather than getting caught up. And only at Cellular Healing and only at Rehabilitation Physicians do we offer that simple, safe, cost-effective treatment. And just to show you that this works, we look at a thing that's called a dose-response curve, meaning that if I give you a drug and I give you a lower dose, if I give it to you at a higher dose, you might see a better response. So we've been following patients, and we have about 700 patients, and we'll show this to you a little bit later, but this is what a dose-response curve looks like. And this is a nice dose-response curve. You can see it slopes up. So the more you give somebody, the better the outcome, because here's the outcome over here, and this is the dosage here. So there you go there. That is what a dose-response curve looks like. And that shows that there is a response. So the more that we give, the better the outcome. And that is something that we, again, are only doing at cellularhealing.net. And we have been able to prove that we can improve your outcome by doing this pre-treatment. So if you're looking for the best treatment that you can find, check us out. You can look online here at cellularhealing.net. You can call us at 248-893-3200, because remember, these are your cells for your healing. God bless you.